begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this episode of Emergency Warning Signs for the Coronavirus, I'd like to discuss bluish face and bluish lips as an emergency symptom. Now once again, if you or someone you are caring for were to experience this symptom, please head to your nearest emergency room immediately and make sure someone contacts your primary care physician right away, because both in Western medicine and Eastern medicine, i.e. Chinese medicine, bluish face or bluish lips is a very serious matter. Now, if you have not viewed my episodes on the blood vessels in coronavirus or the heart in the coronavirus, please take a moment to view them, because there's heavy correlation between what was discussed in those episodes and what I'm about to discuss in this episode. Now, for those who have very little understanding of acupuncture, please view some of my earlier episodes or simply go to my website at acupunctureismylife.com and click on Understanding Acupuncture to learn more. Now let's go over some of the causes of bluish face or lips from a Western medicine perspective before we jump into potential causes from a Chinese medicine perspective. Now, if you're experiencing bluish lips, bluish face, you can also likely experience difficulty breathing as well, which is another emergency warning sign for COVID-19. Now, bluish face and lips can be a sign of blood vessel constriction or arterial blockage. In some cases, bluish face and lips can be a result of, let's say, a heart condition such as cardiac tamponade, or a respiratory condition such as pulmonary edema, acute respiratory distress, pulmonary embolism, and so on. Now, bluish face or lips is a sign of poor oxygen circulation in the blood, which can be defined as cyanosis. Now, central cyanosis is what affects the lips, but can affect the tongue and the chest as well. Now, in some cases, bluish face and lips may require urgent treatment of supplemental oxygen. So I would say there's extreme cause for concern when your lips and your tongue have turned blue and you're experiencing chest pain, difficulty breathing, accompanied with, let's say, headache or confusion and or dizziness. Whereas these accompanying symptoms are also emergency warning signs for COVID-19, in which I've discussed in previous episodes. Now, I'm not going to go too deep into discussing potential causes for the symptom from a Western medicine perspective. Why? Because I'm not a licensed medical doctor. I'm a state licensed, board certified doctor of acupuncture. So I'll jump right into potential causes from a Chinese medicine perspective. Now, in Chinese medicine, the channel most affected, although not exclusive, when presenting with symptoms of bluish face and lips is the heart channel. So potential patterns for that channel will be my focus of discussion just for this episode. Now, to gain a better understanding of the functions of the heart in Chinese medicine, please view my earlier episode on the basic functions of the heart. Now, when it comes to the heart channel, some of the causes of bluish face and lips can present as a result of, let's say, heart-yang collapse, where clinical manifestations can present as palpitations, shortness of breath, as well as cyanosis of the lips. In this case, I would focus on rescuing yang by needling points on the pericardium, stomach, and bladder channels, as well as needling points on the conception and governing vessels. Then there could possibly be heart chi stagnation, where clinical manifestations can present as palpitations, pressure of the chest, shortness of breath, and purple lips. Now, in this case, I would focus on moving heart chi and calming the mind by needling points on the pericardium, heart, stomach, and lung channels, as well as needling points on a conception vessel. Then there could be, let's say, heart vessel obstruction, where clinical manifestations can present as, again, shortness of breath, feeling of like oppression of the chest, stabbing pain in the heart region with purple lips. Now, in this case, I would focus on moving heart chi and moving blood as well, eliminating stasis and resolving any phlegm that may have developed by needling points on the heart, pericardium, stomach, large intestine, and bladder channels, as well as needling points on a conception vessel. Now, bluish face and lips can also present as a result of heart blood stasis, where clinical manifestations can present as palpitations, chest pressure, and cyanosis of the lips. Now, in this case, I would focus on moving blood, eliminating stasis, and tonifying and warming heart yang by needling points on the pericardium, heart, bladder, spleen, and kidney channels, along with points on the conception vessel as well. Now, the heart channel, among possibly other channels, is very likely to present with an imbalance if a patient were to come to my office displaying symptoms, let's say such as bluish face and bluish lips. But please, I advise you go straight to your nearest emergency room and contact your physician if you were to encounter these symptoms. And once this matter is addressed by your doctor, then contact an acupuncturist to discuss this matter further. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?